Uremic Syndrome, and E. coli. Let's get started. Hi, this is James. James is a 6-year-old boy who is currently getting treated for his illness. He was rushed to the hospital after illustrating these symptoms. In his early stages, James faced gastrointestinal symptoms which included abdominal or belly pain, bloody diarrhea, vomiting, fever and chills, and also headache. Followed by the first stage, symptoms advanced to irritability, extreme tiredness, also known as fatigue, small unexplained bruises, jaundice, also known as paleness, decreased urination or blood in the urine. This is due to the fact that damaged red blood cells and other factors can block the kidney's small blood vessels and induce scarring. The kidneys have to work harder to eliminate waste and excess fluid from the bloodstream as a result of this. High blood pressure, swelling of hands and feet due to fluid buildup, also known as edema. The doctor orders some tests to determine James' diagnosis and asks questions about his medical and family history. The first test the doctor orders is a blood test. The blood test is to determine if the blood cells are damaged. They can also reveal a low platelet or red blood cell count or a higher than normal level of creatinine, a waste product generally eliminated by kidneys, hence determining its function. Followed by the urine test. The urine test is to detect abnormal levels of protein, blood, and signs of infection in the urine. A stool sample is also taken to detect the presence of toxin-producing E. coli and other bacteria that cause HUS. Necessary, the physician will order a kidney biopsy to examine a kidney tissue under a microscope to verify the evidence of plasma exchanges, as well as the creatinine test to measure efficiency with which kidneys filter waste. After reviewing the test results, the doctor diagnoses James with Hemolytic Uremic Syndrome. Hemolytic Uremic Syndrome occurs when damaged red blood cells block the area where blood is filtered in the kidney, obstructing the kidney's filtering function. HUS causes blood platelet breakdown, a low red blood cell level, and kidney failure due to damage of the kidney's very small blood capillaries, as illustrated with James. A child can get acute kidney injury if their kidney stops working, resulting in a sudden and transient loss of kidney function. Recalling to where James received his infection, James and his family are ready to visit a new country like every year. Despite that James takes good care of his sanity, as he was taught by his school, James was not aware where else bacteria can be found. James orders water to relieve his thirst from the flight attendant. What James does not know is how clean the cup of water he will receive. James drinks the unbottled airplane water and as a result gets infected with the harmful Escherichia coli bacteria. In fact, a study shows that airplane water tanks can be a habitat for several harmful microbes including E. coli 0157H7 strains since they are rarely cleaned. Other common places where harmful E. coli can be found include undercooked beef meat, raw milk or cheese, unwashed fresh fruits and vegetables which are hard to clean properly prior to eating, contact with animals or their environment. It can also be transmitted from one person to another through fecal or oral route. Now, how did Hemolytic Uremic Syndrome develop in James' body? Hemolytic Uremic Syndrome affected James, who had been infected with Escherichia coli 0157H7 strain, which releases a chemical called Shiga toxin. Shiga toxin causes thrombosis, also known as blood clot, in the body's tiny vessels. As a result, a trio of hemolytic anemia, acute kidney injury, and low platelet count, often known as thrombocytopenia, occur due to the breakdown of red blood cells. In the intestines, E. coli strain 0157H7 releases toxins that induce diarrhea, travel through the bloodstream, destroying red blood cells and damaging the kidneys. So how is harmful E. coli causing HUS different from the beneficial E. coli? In humans, E. coli 0157H7 produces a serious intestinal infection and is the most common strain to cause disease. The development of a powerful Shiga toxin, which destroys the lining of the intestinal wall and causes the bloody diarrhea, distinguishes it from the other beneficial E. coli. E. coli 7H7 is an enterohemorrhagic bacterial strain that causes diarrhea, hemorrhagic colitis, also known as bloody diarrhea, and hemolytic uremic syndrome in humans. It is a major food and waterborne pathogen. Beneficial E. coli promote digestion while also protecting us from other harmful microorganisms. All E. coli are gram-negative, rod-shaped, facultative, anaerobic bacterium. All E. coli exhibit acid and bile tolerance, hence exhibiting promising probiotic properties according to a study done in 2020 by Nakaruk and others. To treat the illness, the doctor avoided the use of antibiotics, and this is because several studies show that the use of antibiotics to treat gastroenteritis or diarrhea has been associated with increased risk of HUS. Antibiotic use has been linked to a reduction in microbe diversity, altered metabolic activity, and the selection of antibiotic-resistant microbes in the gut of microbiota. As a result, the doctor avoided using antibiotics because they put bacterial populations under selection pressure. However, to treat hemolytic uremic syndrome, James demanded a hospital treatment. IV fluids are given to keep a patient hydrated and to replace the lost electrolytes. Transfusion of packed red blood cells for severe anemia was also important. Dialysis might have been needed to keep the blood clean while the kidneys heal. Plasma, exchange with frozen plasma of healthy donor in severe cases might also be needed. Kidney transplant surgery is considered in severe cases. Luckily, with the right hospital care, James was out healthy and fully recovered after a week. The family was very happy to see James back playing around with no issues. James learned what precautions to take in order to prevent himself from an infection, and so do you. Make sure to wash your hands before and after cooking or eating food, before and after using the toilet, before and after contact with animals or the environment. It is also important to wash, peel, and re-wash fruits and vegetables. Boiling or deep cooking meat while avoiding contact of raw meat. Make sure to avoid drinking pool water mistakenly while swimming. Avoid drinking unbottled or unfiltered water, and avoid sharing your food or drinks with others. Remember, microbes are found everywhere around us. It is important to be cautious about your steps before consuming anything, since it is easy to develop illnesses nowadays. We care about your safety. Stay healthy, stay safe.